This spike in cases is once again putting a strain on frontline workers, and the stress can certainly take a toll on their mental health, Al.
That's right, Janelle. In fact, there's a new app called Heroes Health. It launches today, offering those workers access to mental health assessments and resources. Created by Dr. Sam McLean, an emergency physician at the University of North Carolina, and he's here to tell us more about it. Dr. McLean, good morning. Thank you for joining us. And before we get to the app, you're on the front lines every day in the ER in a state whose COVID-19 numbers hit record highs this past weekend. What has it been like in your hospital?
Yeah, over about the last 6 weeks, we've seen a big increase in the number of cases and the number of hospitalizations. So we're definitely feeling it on the front lines. All of the numbers that we hear about on the news, they really translate to experiences of seeing people struggling to breathe in front of us and more patients hitting our doors.
And Doctor, you've been battling this virus since the beginning. Are you more prepared now to treat somebody who comes in with COVID-19 than you were in early March?
Yeah, definitely. I think that every day that goes on, every day of experience we gain, every day of more research that comes out about how to best treat patients, we definitely are in a better position day by day. Obviously, we really need to work as a society, as we're continuing to try to do, to get our numbers of infections down, because infections are really determined by how we act as a society and individually. But I think when patients come in who are ill to the hospital, that no question that time is on our side in terms of gaining more and more understanding of how to best treat them.
Dr. McLean, there are just so many layers to all of this, and I know you've experienced firsthand the stress that treating this virus has caused, which gave you the idea for your new app. It's called Heroes Health, and I know the app sets out to give healthcare workers mental health support. I know Google helped out with the technology aspect. What can someone expect once they sign up?
Yeah, that's a great question. I just wanted to say this app really came about because I was experiencing just all of the stresses that first responders have, with worries about getting infected, much worse worrying about infecting other people, seeing so much tragedy, and a lot of social isolation. And so reached out to a colleague of mine, Obi Felton at Google, who was immediately all in, and was very fortunate to work with friends at Harvard and other academic centers, as well as a slew of fantastic folks across UNC, and then with volunteers, dozens of volunteers across Google and Alphabet, to build the app on Google Cloud, which is their cloud computing platform, really terrific, and allowed us to stand this up in only a matter of a couple months. The goal of the app is to give everyone the opportunity to check in on their mental health regularly and to link them up immediately with resources. So if you go to the Google Play Store or App Store and you search Heroes Health and download the app, what you'll find is that after you sign up, you get about a 5-minute survey to complete every week. And after the survey, which assesses things like anxiety, depression, stress, and sleep, you get a real brief summary picture of where you are with your symptoms, and then you can see trends over time, and then very importantly, links to great resources, really emphasizing resources that are either free or low cost to healthcare workers.
And Dr. McLean, you yourself were diagnosed with COVID-19 back in March with your wife and son. How are you all doing today?
Thank you so much. We're really doing well, and we're very fortunate to recover from the virus. I think that our experience working in the COVID unit really just emphasized how we need ways to lift each other up and to support each other within our medical communities, both individually through the app, and then also for institutions or organizations that partner on the app also provides leadership with information on how all the healthcare workers are doing at that organization. So, for example, at the places that are really hard hit today, Miami, Houston, so many others, I think it's hard for hospital leaders to know how are the nurses doing in the ICU? How are the environmental services folks doing that do a wonderful job of cleaning rooms for patients in the emergency department? And so this app allows them to track over time and see if parts of their community are really getting into trouble with their mental health, so that they can support, and that they're not just flying blind like an airplane with no instruments.
And doctor, your pug Winston was also diagnosed with COVID-19. In fact, first dog diagnosed with the virus. How's Winston doing? And is he around for we could say a quick hello?
Yes, he is. Winston's doing great. So fortunately, Winston was able to fit you guys in between his early morning and mid-morning nap. So you caught him at right that great time at his schedule. And so here's Winston, and Winston is fully recovered, and he wishes everyone a fantastic week. And he just says wear a mask and socially distance. He recommends that you not keep your tongue hanging out. So he sets a bad example.
Yes.
He knows it's a personal foible that he has, but he says it does not help with COVID transmission to either leave your tongue out or to also try to avoid sniffing other humans. That's his recommendations for us.
Yes,
Cutie.
yes, and don't stick your head out the window. Dr. McLean, Winston, thank you.
My last little request is if you're
we have to go.
Okay, sorry. Thanks so much.
All right, we'll put information on our website. Doctor, thank you. Craig?